Hello, my name is J.Salyer, and I guess he wants to be part of it too. This is Hank Snow. I'm a student at Morehead State University, and this is for a nursing class, NURB 461, and the purpose of this video is to report on a movie that's based upon a medical theme. The movie that I wish to report upon is called MissEversBoys. It's a 1977 HBO movie that was based upon the true story of the Tuskegee experiment. As you may well know, the Tuskegee experiment, it's a very dark time in our nation's history, and also a very dark time in the history of medicine. It was a study of syphilis and how syphilis might affect the bodies of Negro men, and it was conducted from 1932 to 1972, so there was a 40-year span that this movie takes in. The movie stars Alfre Woodard, and she was Miss Eunice Evers in the movie, and it also stars Lawrence Fishburne, and he was Caleb Humphreys in the movie. Besides the two stars, Ossie Davis was in the movie. He was Miss Evers' father. It only called him Mr. Evers, whom she resided with. E.G. Marshall, who was a senator that was conducting the Senate investigation. Joe Morton, he was Dr. Broadus, the black physician that Miss Evers was working with in the hospital. And Craig Sheffer, he was Dr. Douglas, who was a physician that was sent by the United States government to help conduct the experiment. The setting of this story is rural Macon County, Alabama, and it's that's where Tuskegee is located. And it's in 1932 when the start of the experiment was. It's an area of poverty, and not just poverty because the entire nation was in poverty in 1932 associated with the Great Depression, but this is poverty that's related to a rural area that was 80% black population. They were uneducated, had very substandard housing, and there just weren't any jobs. And of that 80% of the black population, 35% of those black individuals were infected with the syphilis virus. You also learned at the start of this movie that in Tuskegee was one of the few all-black hospitals located in the South. So that was another reason why they wanted to do it here. And it was one of the highest areas of concentration of blacks with syphilis. It was just, well, you can imagine 35% of the population having syphilis. It was rampant. The movie starts with showing an elderly Miss Evers that's testifying before the Senate subcommittee, and it's a very crowded Senate chambers, reporters in there, lights flashing, with the flash bulbs. And it's in March of 1973. You see this elderly Miss Evers, and she starts telling about what has occurred. And Miss Evers even makes the comment that these men received the best medical care that they could have ever received in their life, knowing that she was knowing even that they weren't being treated, but she still evaluated it to be the best medical care that they could receive. In the background, from where Miss Evers is speaking, you can see Dr. Broadus, an elderly Dr. Broadus, who is sitting in the courtroom behind her. This entire story is told as a flashback. The subcommittee will be asking her a question, and then she'll flash back in time and relate to them the story that as it's unfolding. With all of these flashbacks, the movie is exploring racial prejudice. You even hear in one part of the movie where Caleb Humphreys, Caleb was the star of the movie, Lawrence Fishburne, Caleb reveals to Miss Evers that his brother was killed in a lynching, and that's why he stayed in Macon County, and why he quit school, because he was very bright, but he had quit school because after his brother had been lynched. You see breach of confidentiality. Miss Evers shares some of the facts of the study with Caleb. You see unethical behavior of all the medical professionals, with knowing that the individuals were not going to be treated. They were practicing unethical behavior. Poverty, as I mentioned before, it's a very impoverished area. There's a lack of access to medical care. No one could afford the medical care. It was beyond their financial means. The morality of the area was explored. Miss Evers, she was fraternizing with the patients, fraternizing with the people that were in the study. She had a romantic relationship with this Caleb Humphreys. And also she was fraternizing with the other gentlemen of the group, the ones that were referred to as MissEversBoys. We'll hear more about that in just a minute. There was also dishonesty. They never revealed to the men that there was a cure available, that they were not being cured. They were not being given penicillin, which was available 10 years after the study started. By 1942, penicillin was in good supply. Also, there was malpractice. As I said, they weren't treating the patients when there was treatment available. Back to why her fraternizing with patients and why it was called MissEversBoys. There was a group of 4 individuals that were musicians and dancers. These individuals, they didn't have transportation to go to their competitions. They didn't even have adequate food. They had, as I said, no medical care, and the conditions were so poor. Well, Miss Evers was supplying those needs. She was driving them to the competitions. She was making sure they were fed when they would come in for medical testing, so they got food. She was making sure they had medical care besides notwithstanding the treatment for the syphilis, but other medical care. Also, they were given money. They were given enough money to bury them. So these areas were covered, so much so that these men were indebted to her and called the name of their musical group, their dancing group, they called them MissEversBoys. So she had so endeared herself to these individuals that they trusted her. They trusted her for proper care. They trusted her to be honest with them. And she had a breach of that trust. Miss Evers, she forever contended that she had done what was the right thing. She was never convinced that what she had done was wrong. I don't know what I would have done. I don't feel that I would have done what Miss Evers did, being in her situation. But again, I can't put myself totally in her position to realize how her feelings were at the time. But it's a very good movie. It has a good story to it. There's a lot of good history in it. But also you get to explore all of these factors of ethical and moral lessons that can be learned by any professional in this. And I think each of you will enjoy it. I think Hank enjoyed it also. Again, thank you for your time. And this is J.Salyer for NURB 461, Morehead State University. Thank you.